Everyone, welcome to week 6. I hope you all have a good week and have some good plans. Sure, eating some good food. I just want you to be mindful that your papers are due this week. Please make sure that we're focusing on the alleged problem that the paper is asking and that we're not focusing on the little problems. Sometimes I see everyone getting sidetracked by that. Please make sure you're answering every single question thoroughly. And if you have any questions about that, please feel free to email me. Please also don't forget your APA format. I'm noticing when I'm reading some of your assignments that a lot of you aren't using APA correctly. I don't think that's a fault of yours. I think that, you guys are just so busy with everything going on that, you forget a period here, parenthesis there. But just make sure, because sometimes it's coming up in the turnitin.com as plagiarism. And I have been very kind with some of you, and you know who you are. But please, let's make sure that we are using the proper APA format. So this week we're going to be talking about working with people who are developmentally disabled. The definition of a developmentally disabled person is a physical or mental impairment that develops prior to adulthood. So some common developmental disabilities you're used to seeing are intellectual disabilities, autism, cerebral palsy, and Down syndrome. Now, as many of you know, developmental diagnosis is it's a severity. So, for example, you can have a nonverbal autistic, you can have a mild autism, you can have severe autism. So there's different levels of developmental disabilities, and each level has its own requirement for what it needs. Now, some, unfortunately, with a developmental disability, it could be extremely debilitating, where unfortunately they're going to be living in a group home, or maybe they're going to have a live-in caregiver. You find often that if you have an autistic client or somebody who's intellectually delayed and they're in their later 30s or 40s, you see that the parents have been taking care of them their whole life. And unfortunately, now they're looking at that fact that they're soon going to be gone, and who will now take care of my child? And that's where a lot of adult people with intellectual disability come into our role, because maybe they've never had services before, or they did and they've been successful. So unfortunately, we see a lot of that coming actually more in the adult world. If they're less severe, if they're more severe, we're going to see them when they're in the pediatric world. Now, each state is completely different. Some states believe in a group home model and others believe in a community model. Some states believe that it is not fit to have group homes. They feel like everybody should be in the community, living in their own apartment, and maybe having an agency go in and out supervising them. Some states do believe in group homes and believe that people do not have the capacity to make decisions for themselves. So that's where guardianship or power of attorney come into play. And mostly, sometimes there will be agencies that go in and out. You may even know of a group home in your town or community. And if you do, you know for a fact that sometimes these our poor clients get scrutinized because of the fact that nobody wants them to live on their block. Nobody wants them by their children. So they always are very fearful that, our clients are going to be extremely aggressive and attack their children. So it's really our job to obviously advocate for our patients. So I really encourage you to look into your community and see what services they have for developmentally delayed people. Now, a lot of their fear also comes into play because it's not a surprise when a patient who is developmentally delayed also comes with a component of mental health. So you're going to see a lot of aggression, paranoia, psychosis exhibited, and this confuses society because they don't really know how to act. Is the patient developmentally delayed first, or do they have mental health first? And that is very confusing to people. Sometimes it's even confusing to psychiatrists about what to treat. Do they treat the aggression with medication? Do they treat the level of functioning? Giving them some stimulants sometimes to help them calm down is really helpful. And sometimes psychiatrists get a little bit confused as to, well, this person is extremely aggressive, maybe I should give them a downer at the same time. So sometimes working on their medication is extremely, extremely difficult. So we have to do a really good job at seeing what medications impact them in positive ways and negative ways, so we can always work with the medical staff to make sure it's benefiting the patient. So it's not uncommon that when you have a developmentally delayed patient that they are going to be maybe in an inpatient hospitalization often, because as they grow from a pediatric to an adult, their metabolism is going to change. So they're going to need a lot of med changes throughout their life. So unfortunately, inpatient does happen when they are more severe. So for young children, you're going to see a lot of them in behavioral classes. They may even have a one-to-one support in their classes. Some may even have an IEP, a 504 plan in order to stay in the classroom setting. And then you're going to have some of those patients who just are not equipped and they are in an alternative school. Our role as a social worker with the developmentally delayed population is key to their success. So the earlier the intervention, the better success for the patient. The best thing in working with parents to assist in education on managing behaviors and symptoms. Most parents are very much in denial about what their 2-year-old was just diagnosed with. No parent wants to know at the age of 2 that their child is going to have a very difficult life. And that's very hard for parents to swallow. So it's really our job to do the best that we can in helping them understand the services that they have access to and helping them know that they are not alone. So sometimes there are support groups that agencies have, and I really recommend that you learn in your community if you do have a patient such as that. If their 2-year-old starts headbanging, having speech problems, they can't walk, that's when in my state there's something called Fresh Start for children that young. So it's always good to be knowledgeable of those things, because you may even have an adult client who's experiencing a child who has those symptoms. So as the social worker, we want to get the background of the developmentally delayed patient. If they were ever exposed to drugs in the womb, they could have been, unfortunately, detoxing from a drug. They could have had fetal alcohol syndrome. There's a lot of things that could have happened that could have caused it. There could have been trauma outside. Mom could have been in a domestic violence relationship and she was punched in the stomach a lot. So we really want to gather what happened, if anything happened during the pregnancy, because that's really vital too in helping understand what happened. Unfortunately, children who do have developmental diagnoses are more likely to be abused because people assume that they can't express themselves. So I challenge you to approach every developmentally delayed client like they have, because unfortunately, their aggression and their sexual acting out, they learned it from somewhere. So their aggression is they're frustrated because they can't tell you how they feel. So instead of telling you how they feel, they're going to go punch that wall because that's going to make them feel better. So we need to be able to interact with them. So sometimes what I've even done is I've given my patient a pillow. So they're punching the pillow and I have my pillow and we're punching the pillow together. And that helps the patient see that I am working with them. And then most often when you can get a developmentally delayed client to calm down with their aggression, they're very, very artistic. Some will actually draw out what is going on. So I really encourage you to look up different and creative ways, because sometimes, most of the time, talk therapy isn't going to be work for them. So we have to be creative in different ways. So, I challenge you to look, the aggression that we talked about earlier, is it diagnosis related or is it trauma related? You always have to go with those lens in thinking, what could it be? So if a patient attacks a teacher, and mom every single day, how do we interpret that? Now, there's many different ways we could interpret it, but as the social worker, we have to fight through those challenges and work with the mom and work with the teacher to figure out what is going on. Is he only aggressive at school with that specific teacher? Then there's an issue there. There's something that the teacher is saying or doing that's triggering that patient, and we need to really figure out what that is to help that patient succeed. So I always challenge you, because I want you to think, if your 10-year-old autistic child is screaming, "You're stupid, you're worthless," they heard it from somewhere and they heard it from someone. So as I said before, they are very autistic, so they can draw it, they can sing it, they can mold it with clay, they can paint it. They really can do whatever they need to do to express themselves to you. So talk therapy may not be beneficial. And being able to process through, they need to really, even sometimes I've done like little dolls, Barbies. Sometimes it's really interesting to see them act out with the Barbies, kind of what's going on. There really is a growing need for adult developmentally delayed support. There's so much focus on the child and adolescent population because a lot of people gravitate toward wanting to help that population, that the adult world really does not have a lot of resources. So when you have parents of developmentally delayed clients who are passing away, leaving these patients without any support, can get mixed up in the criminal system and the mental health system, which you often see. Sometimes people who are in their 30s, 40s, and even 50s, you're surprised that they've never been in the system before, but that's because their parents, like I stated earlier, have been protecting them their whole life. So I challenge you always to challenge the system, advocate for these patients because they're extremely vulnerable and they're unable to speak for themselves. And we need to fight for resources for them, for patients of all ages with developmentally delayed, because they need our intervention. So I challenge you all to be that good social worker, to challenge, don't be afraid to ever challenge authority, to ever challenge, don't challenge your supervisor, but, say it in a nice way where, the patients are our priority. It's our job to speak for people who cannot speak for themselves. So it's our job to find what it is that they can succeed with, and we can help them get there. So if you guys are watching this, I will give you 0.5 on your paper that's due this week. If you can email me a developmentally diagnosis that would be difficult to work with and why. And really, 1 or 2 sentences, doesn't have to be really explanatory, but just explaining why that would be difficult for you. All right, everyone, have a fantastic week, and I will see you soon.